Hello, I'm Dr. Claire Touchie, the Chief Medical Education Advisor for the Medical Council of Canada. As you know, the MCC is the organization that is charged with assessing medical students and graduates through exams, focused on core competencies. Anyone wishing to practice medicine in Canada is required to pass the appropriate MCC examinations prior to receiving their LMCC qualifications. The LMCC is one of the requirements for a full medical licensure. The MCC process for conducting these different exams is evolving to meet the needs of Canadians who face changing demographics, new areas of needs, and new approaches to healthcare. In this short presentation, I will cover 3 key topics. 1, where is this evolution of MCC examinations taking us? 2, how will the examinations be affected or changed? And 3, how will the candidates prepare for these examinations? The presentation you are watching now has been specifically prepared for international candidates who wish to pursue residency or eventually a full medical license in Canada. The MCC is currently evolving all its processes for testing, both for Canadians and international applicants. Later in this presentation, I will outline the changes we are making to international and national testing, as well as the support we are putting in place. But first, let's review the core developments in our evolution. They will be essential to how you study and prepare to be a Canadian physician. This chart represents our foundational overview to how the MCC is evolving its examinations. Think of it as the basic blueprint we are building the future of testing on. Physician activities and dimensions of care will define testing requirements. Along the top menu of the blueprint are the 4 core dimensions of care that together cover the spectrum of medical care. A patient will usually present himself to medical care through one of these topic headings, if not more. It begins with health promotion and illness prevention, followed by acute care and chronic care, and also the psychosocial aspects of care. On the side menu are the activities expected of our physicians when addressing and managing the various dimensions of a patient's care. It begins with assessment and diagnosis. There is management of the required care, proper communication, and professional behaviors. Taken together, the top menu shows how patients present to a physician, and the side menu, what physicians need to consider and do. We encourage you to explore detailed definitions in the glossary available on this site. Because the blueprint plan has been applied to the evolution of both our qualifying examinations, candidates will know what to expect as they are assessed at 2 important transition points in their medical career. 1, at entry into residency, and 2, at entry into independent practice. For the Part 1 examination, which assesses physicians at the time of entry into residency, the weightings will look like this. Under the physician's activity menu, assessment and diagnosis and management will account for 80% of the exam, whereas communication and professional behavior will comprise about 20%. For the dimensions of care, health promotion and disease prevention, and the psychosocial aspects of care will each comprise approximately 15% of the examination, while acute and chronic care will be valued at 70%. In spring 2018, the new Part 1 exam will be launched based on these content weightings arrived at through consultation with our stakeholders. Then in fall 2018, the Part 2 exam will go live as well. The Part 2 exam assesses candidates for entry into independent practice. The same MCC blueprint that defines the Part 1 exam also underpins the Part 2 exam, except the weightings are adjusted to match the increasing responsibility of physicians at that point in their career. For example, there will be a slightly increased emphasis on management of patients, and there will be a significant portion on communication and professional behavior, and there will be a slight increase in testing of chronic care. All are essential areas for physicians looking to receive their LMCC to practice medicine in Canada. This is an evolutionary process, so we will be modifying, aligning, and adding new content to be fully prepared. Passing the Part 2 exam is one of the requirements for a full independent license in Canada. The Part 2 examination format is what we call an objective structured clinical examination, or OSCE. It features clinical stations, each with a physician examiner and a standardized patient. This exam takes place over 2 days. Day 1 will have 7 14-minute stations with 2 minutes in between each of the stations. There will also be 1 pilot station incorporated into that day. Day 2 will be 3 paired stations and 1 pilot station. The paired stations will be 6 minutes each with 2 minutes between each station. We will be assessing foundational competencies at these new stations, competencies that we believe all physicians must have by the time they enter independent practice. In addition to assessing focused history and physical examination skills, topics would include things such as organizing a discharge, discussing goals of care, delivering difficult news, dealing with forgetful or angry patients, providing advice for health promotion, disease prevention or management, interacting with colleagues in various situations and interactions, and addressing conflicts within the healthcare team. As mentioned, the new Part 2 exam goes live in the fall of 2018. We are in constant contact with the schools and the testing sites are fully engaged. They know the changes that are coming and have already begun working with new MCC pilot content. With new content and communication assets like this site, we'll also be enhancing candidate and examiner orientation. The new focus on improved processes for testing is coming soon, and the experience will be better for all. To help candidates prepare for this assessment evolution, we're going to be using a multi-prong approach. We will have enhanced support material. We'll also be preparing and posting self-assessment examinations and preparatory examinations online. There are new orientation programs on physiciansapply.ca. We've launched 6 cases on topics related to cultural and communication competency, in addition to a dedicated communication skills module. These orientation modules have clear learning objectives and are linked to the MCC examination objectives. The cases involve different aspects of cultural competency or communication skills, things like consent, confidentiality, professional behavior, and boundary crossing are addressed in the modules. The MCC will also be launching new orientation material to help candidates familiarize themselves with the revamped OSCE exam format. Another excellent study resource are the MCC Objectives. They also align with the blueprint. If we look at the blueprint here and use diabetes as an example under assessment and diagnosis in health promotion and illness prevention, an example of a task would be to list and interpret critical clinical findings, including risk factors. A question could focus on the identification of important risk factors for diabetes. Under management and acute care, you could be asked about initial management of a patient presenting with diabetic ketoacidosis. Another example would be a question related to counseling a patient unable to afford their prescribed medication. This would fall under the category of communication and psychosocial aspects of care. Let's take dementia as another example of an MCC objective. A scenario could be presented of a patient with dementia presenting with signs and symptoms of neglect. You could be asked about your obligations as a physician. This would fall under professional behavior and chronic care. During the research and discovery phase of the MCC evolution, a number of issues were identified for improvement that directly impact international students and graduates. They include 1, the request for more opportunities to take and retake the MCC QE Part 1. 2, the need to simplify and streamline the evaluation process for international students and graduates. And 3, the request for more exhaustive preparatory resources. We're pleased to report that all these issues have been addressed. Our foundational blueprint and international student and graduate support materials will now be better linked with the requirements of the MCC QE Part 1 and Part 2. As of 2019, the MCC QE Part 1 will be available internationally in over 80 countries. Effectively, candidates will soon be able to take the MCC QE Part 1 and the NAC exam at approximately the same time. To help candidates prepare for the higher level of difficulty of the MCC QE Part 1 compared to the current entry exam, the MCCEE, the candidates will be supported by new online tools and resources to help prepare them. The MCC is committed to supporting international students and graduates in their quest to practice in Canada. In summary, the MCC assessment evolution is aligning knowledge, skills, and testing with 21st century medicine and advances in healthcare delivery. It connects directly and realistically with the types of problems physicians deal with daily in Canada and the types of activities they perform. MCC evolution is not simply one thing. We are creating and delivering a completely updated package of learning supports. With enhanced examination preparation assets coming online, more authentic clinical scenarios, and better, faster access to testing across the country, the experience for all will be greatly improved. The MCC evolution also extends to those of you coming from international locations to the Canadian healthcare system for testing. Thank you for watching, and good luck with your studies.